Welcome to Hypertension course. In this course, we will study how to reduce your blood pressure using cutting-edge research. My name is Roman Turgovitsky, and I will be your instructor. I will say just a couple of words about myself. I graduated from Harvard University with a PhD. I did research in sleep medicine and brain imaging. Then for a couple of years, I continued to work in research, both as a postdoc as well as at several companies. And then I created Soma System, Soma Clinic, for where we practice non-pharmacological approaches to treating various chronic conditions. And in 2014, I created Healing War Scars, where we help veterans to overcome post-traumatic stress symptoms. Okay, so this block is very short. It's an introduction, and I will try to briefly share what you will be learning in this course. So first of all, why hypertension is so important? Well, the reason is very simple. It is a major risk factor for many common chronic conditions, such as heart failure, myocardial infarction, stroke, kidney disease. Hypertension can lead to organ damage and ultimately death. So it's a very serious condition, and this is why before we start, I want to emphasize, if you suspect or if you know that you have hypertension, you do need to have a physician supervising you. You need to be 100% under the supervision of a physician. So if you do not have a physician right now, then I encourage you to stop this video and go and find a physician with whom you can discuss hypertension. Now, we know from research that if you reduce blood pressure, maybe with medications or lifestyle changing programs, then reduction in blood pressure actually leads to reduction in mortality and decreased likelihood of getting a stroke or heart failure or organ damage or kidney disease. So what we learn from this is that decreasing blood pressure is absolutely very important. Now, how do we decrease or control high blood pressure? I'm sure you know that there are a number of hypertensive drugs. These drugs actually can be life-saving. If your high pressure is way too high, then it's very important to decrease the pressure as soon as possible, and that's one of the reasons why you absolutely need to have a physician with you. Now, the problem with drug therapy is that there are fairly serious side effects that these drugs have, and we will study some of these side effects in the course. And then, of course, there is a drug-resistant hypertension, meaning that you take the drugs as physician prescribed you, and still you are hypertensive. And finally, there is this issue which practically no patients know about, and that issue is actually with your physician. Clinical physicians are on average 17 years behind the current medical research. And this is for drug therapy. For non-drug therapy, for non-pharmacological therapy, clinicians are oftentimes over 20 years behind the modern cutting-edge non-pharmacological medical research. So on the left, you can see the reference for the paper. And actually, the paper is titled, "The Answer is 17 Years. What is the question? Understanding the time lags in translational research." So this is what most patients do not realize. We all hope that when we go to see a physician, then this physician is up to date on the current medical research. Unfortunately, this is not the reality, and it's not really surprising because the physician probably cannot be up to date on the cutting edge research on all the conditions that he or she is treating, because the physician is extremely busy seeing so many patients, so they just don't have time, oftentimes, to get up to speed on the research. Now, what that means for you, for the patient, is that basically, unfortunately, you do not fully benefit from all the cutting edge medical and basic science research, which is sponsored by your tax dollars. And therefore, it is the goal of this course to inform you about the cutting edge hypertension research, and especially non-pharmacological treatments that basically have no side effects and that can be extremely beneficial to you in your goal or attempt to decrease your blood pressure. Now, this is it for the introductory section. In the next section, I will actually share with you a real life story of two people. One of the guys, an executive, he actually didn't follow the advice of his physicians, and he ended up being pretty well. The other person actually followed blindly the advice of the physician without checking on the current research, and that person unfortunately ended up dying. So in the next section, you will understand through the real story how important it is for you to actually know the modern cutting edge scientific research on hypertension. This is it for this section, and I will see you in the next section.